Professor Akram, when was your first ECR?
It was 2014 when I first came to attend ECR, but the experience was so good that since then I am coming every year.
Oh, that's nice.
Uninterrupted.
Good.
Uninterrupted.
Pakistan is ESR meets country this year.
Yes.
How beneficial has it been to be participating in the program?
It has been very beneficial. It has motivated our radiologists. The number of abstracts sent to ECR this year has been tremendously high. It was about 150% increase in the number of abstracts. So our radiologists, they have got this incentive, and the number of radiologists visiting ECR this year is again very high. It has helped in creating a more educational and research environment in Pakistan. Our doctors, our radiologists, they are more motivated. So it has been helpful in so many ways.
That's good to hear. And what can the audience expect from the ESR Meets Pakistan session?
We try to select certain issues which are a special challenge to Pakistan, so that the rest of the world knows what issues we are facing and how we are dealing with them. In Pakistan, there are two major pathologies. One are the infections and other are the malignancies. And in infections, the one big challenge in Pakistan is chronic hepatitis. And it is in fact one of the countries which have highest incidence of this chronic hepatitis. In hepatitis, radiology plays a very critical role, not only in diagnosis, but in its management, and then seeing whether some complications have taken place or not. It also helps in whether and when to go for surgical treatment and when not. And then in monitoring the treatment of hepatitis, again, radiology plays a crucial role. And now in certain patients, when they have reached the end-stage disease, when there is no other remedy except to replacement of liver tissue, so that we have also started. We have a center which has started living donor liver transplant. That work is going ahead. We have done a good number of cases. So that is one challenge which we are dealing with, which is chronic hepatitis. The second one is tuberculosis. Now, again, Pakistan is one of the countries which is having a high number of tuberculosis patients. The important thing about tuberculosis is that it can present in so many ways, and it can involve virtually any part of body. It may involve brain, bone, urinary system, anywhere. And then the presentation, the signs which it shows, it has a galaxy of appearances. For example, in chest, we can have cavitation, calcification, we can have an appearance like a tumor, and so on. So we face a real challenge in diagnosing tuberculosis in different systems of the body, and radiologists play a big role in that. Among the malignancies, Pakistan has one of the highest number of cases of breast cancer. And our ladies, they are getting breast cancer at a relatively early age. And the problem is lack of awareness that we are fighting with this issue, how to make women aware of this. Because generally, they come to us very late. And when they come to radiologist or to doctor, mostly the case has spread to other parts of body, and then we have to decide whether chemotherapy would be useful or whether some surgical or radiotherapy. So that is again one of the big challenges Pakistan is facing.
Okay. So all of this will be covered in the session?
Yes, it will be covered.
And you probably arrived today, or did you come in yesterday?
I reached day before yesterday.
Okay, and you did you already have a time to walk around the ECR city?
Yes, I have.
And what's your favorite feature here?
Generally, the area where other radiological societies, they have their booths. That is my favorite area, because that is a place where you meet radiologists from other countries. You exchange ideas with them, you liaison with them, and by visiting that, we have established relations with a number of radiological societies through that area. So that is, to me, that is most important.
So the International Village.
International
the M
Village.
building,
Yes,
exactly.
yes.
And there will be a European diploma in radiology in Pakistan next year. Why would you recommend young radiologists take the exam?
Well, a European diploma in radiology is already taking place in Pakistan. 2 exams have already been held. And initially, the first exam, there were about 50 students. But the exam became so popular that in the next exam, we entertained 100 students. Now, the third exam is in the pipeline, which we hope to hold during early part of 2020. And we are again expecting a good number of candidates. Now, our radiologists, they are very clear that if they pass this exam, it adds an additional feather to their cap. It increases their profile. Whether they go to interview for any job, if they are having this additional qualification, they would be preferred, not only in Pakistan, but outside Pakistan as well. So it is very useful. It is having very good reputation, and more candidates are coming for it. And those who have yet not decided to sit in this exam, I would advise them that they should do it, because in any case, it is an additional weightage in their profile.
Yeah.
Yes.
Thank you very much. So enjoy your stay in Vienna and enjoy the conference. And I hope to see you again next year.
Right. Thank you. Thank you very much. Thank you. It was a pleasure.